Among the alternative medicine systems, there is one called music therapy, which uses music to treat certain kinds of disorders. One of the practitioners of this therapy is Dr. T.V. Sairam, who is at present Member Technical, Customs, Excise and Service Tax Appellate Tribunal. And he has done a lot of work for the last 15 years. And he will tell us about what is this music therapy and how does it work and for which disorders it is more effective. Dr. Sairam, you are in the Customs Department. This is a very, very responsible job and very hectic job also. How did you come into this particular area of music therapy? What made you come into this area?
Perhaps because the job was very hectic, as you pointed out. I needed some avenues to reduce my tensions. That could be the reason why I opted for music, and I used to be not only a regular listener but also a performer, because when I perform keeping a tampura in the late evening when I return from office, I find that experience gives me enough confidence and enough relaxation so that the next day whatever challenges I am going to face, I can face boldly. So this is what my personal experience of music.
You see, you enjoy music because maybe you have a taste for it, because we always say that everybody cannot appreciate good music because one has to have the ear for that. As an individual, you may have favorite classical ragas and all, so you may be enjoying playing the tanpura and maybe singing also. But can this apply to every individual who may not have an ear for music?
What I feel is music has two aspects. One is aesthetic aspect. The second is therapeutic aspect. We find that in recent years, the aesthetic aspect of music has been greatly put into use, and so many systems of music have developed all over the world. And even in India, we have different schools of music like Patiala Gharana, Agra Gharana, Delhi Gharana, although Hindustani music is only one entity. Similarly, in Carnatic music also, we have several paddhatis. There, different schools have different approaches towards music, mainly because of exploring the aesthetic possibilities of music. But for a moment, we listen to the Nada Yoga principles, which is as ancient as our tantric times. We have a sense of sound and consciousness being equated with each other. According to Nada Yoga, there are 4 levels of consciousness: Para, Pashyanti, Madhyama and Vaikhari. And it is very surprising that after the discovery of electroencephalogram and many researches which has taken place by brain scientists abroad in recent years, in the last decade or two, they have discovered the existence of brain waves, and whenever the consciousness level is altered, suddenly we become relaxed or suddenly we become active. All these things are contributed by the change in the brain waves. So they have also incidentally discovered only 4 types of brain waves, like alpha, beta, theta and delta. And all these 4 stages of brain waves are being equated to the same type of consciousness levels which Nada Yogis had discovered 5,000 years back. So there is tremendous correlation between the modern science and what was taken as a metaphysical principle.
Now, this is about the consciousness and the activity of the brain that you are just talking about. How is music rather related to this kind of stages or 4 states of the brain?
As we know, music is nothing but a sound emanation. When we say music, we bring our mind to the picture to say that a note which is sounded is musical or it is non-musical. So the distinction of noise and music emanates from the very same sound material. So it is a sound that makes us think and interpret as music or as noise. So basically there is nothing called music which is separated from the sound or noise which is separated from music. It is our mind through the discrimination points out that, there is a certain orderliness in the sound, so let me call it a music. And if there is a disorderliness sound and variability of sound and too much of decibel difference like noise, then we call it noise. So this is the major difference.
So we know that the musical notes have a definite mathematical relationship, the octaves and all these things, and noise obviously don't follow these kind of rules. And different classical systems that we have in India, the Hindustani classical music and Carnatic classical music, they are totally different in the sense, although the basic ragas may be similar, but the actual performance or actual structure of the music, they are different. So do they differ in their impact on the mind of the person or the listener?
Basically, the soul of music is only one. Only the physical manifestation or the procedural manifestations are different. That way, if you observe what is the difference between Carnatic and Hindustani music, the soul of both the system, I find it is one. The basic principles are one. But the way they are presented, the way they are interpreted and elaborated, there is a difference. Otherwise, basically, they are all one. Not only that, you don't have to say that only Hindustani and classical are one and the same. I would rather interpret that pop music, Western classical music, jazz music, Bollywood music, even music in Tamil films and African music, they all stem from the same soul of sound. There is no distinction. The distinction is because of our regional likes and dislikes, regional habits, and our own interpretations from various geographical points. These differences have come up. Otherwise, music, like God, is only one.
Now, when you talk of music, as you just said that it has this definite structure as compared to noise, which has no structure. When you talk of music therapy, how can music really affect an individual to maybe cure some sort of disorder or pain or things like that? Because we know a drug works by acting with some either bacteria or even some molecules in the body, and then it brings about the relief. How can music do it? Because you have been working in this field for quite long years. So what is your idea about the way the music therapy works?
The probable mechanism, I can say, in recent years, tremendous nexus has been found by the neurologists between a neuron and a musical frequency. That means whatever musical frequencies available outside our body are already there in our brain in the form of neurons. That sort of discoveries are coming up in the last 1 decade. So, when we see that and when we compare this with our traditional knowledge of Nadi Yoga, in which the same principle was adopted, that there is a clear nexus between mind and music. For each particular frequency, they have discovered a neuron. To analyze, to assimilate that particular frequency, there has got to be a neuron. That is what the brain technicians talk about. One-to-one basis,
Surprising,
so it is very close nexus between a sound emanation and the way the sound is received in our brain through neurons.
No, then how does it change the disorder, if we say?
That says that there is an instantaneous interface between a sound emanation outside our body and the receptors in our body. Like Adi Shankaracharya once said, Evaiha, like that. Evaiha means right now. He says, when will you have self-realization? Somebody asked. He said, if you have self-realization, you have right now. Otherwise, there is nothing that tomorrow you will have or day after tomorrow you have. It's the same principle in which our brain receives the sound. So, a sort of selected sound emanations, if we can give to our people, then there's so much of stress, so much of tension around us, which is felt by people, so much of depression existing among our youngsters. All these things could be tackled with these selected sounds.
See, whether we talk of music or whether we talk of noise, it produces different kind of impact on different individuals. For instance, one may be very fond of classical music and it may be very pleasing to him. But another person may not like classical music, he may find it too boring. Obviously, if we just talk of its impact or effect on mind, the same music may have different effects on two different minds who are not tuned to that kind of thing, or really they are not attuned to listening to that kind of a music. Similarly, noise. You have mentioned about jazz music, rock music and all. Many people find rock music too noisy and too loud and they don't find anything musical in it. But youngsters, there are a lot of people who like them very much. They enjoy. So again, it's a question of perception. So obviously, the appreciation of music or getting relaxed or getting good feeling is basically a subjective material. In medicine, for instance, we normally don't talk of subjective kind of relation between the disease and the treatment. Because if penicillin works against a bacteria, whether it's in my body or anybody else's body, it works. But the same cannot be said of music therapy. Yes. So how do you decide? Because most of the impact of music therapy will be on mental states.
Exactly.
Like depression, or there are so many other things, sort of fear, anxiety, these kind of things. So this can be explained. But again, here comes the point, how do you select? If a particular patient has come to you for music therapy, how will you treat him? With what kind of music? How will you decide what kind of music will work on him?
I got your point. There is a saying that one man's meat is another's poison. The same principle works when anything which governs our mind comes. Because although we say we are human species, how much of difference is there? In a single earth, there are so many continents are there. So many human species live in those continents. Even in the Indian subcontinent, there are so much of anthropological varieties of human species. And with their own likes and dislikes, with their own lifestyle patterns, with their own preferences of clothing, with their own voice, language, all these things make a person like some music or to dislike some music, although both are music. For instance, I happened to be in Bombay a few days back, and I had to put up with a friend of mine whose flat is located near the railway track in Churchgate. Between say 12 midnight and 4 o'clock in the morning, only those 4 hours, no trains pass through his flat. The remaining 20 hours, constantly every 5 minutes, some train or the other passes through his flat. So the first day when I was put up there, I could not sleep properly because I found up to 12 o'clock or 1 o'clock the train goes on every 5 minutes, tuck, 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 like that noise goes on. And then again it starts in the morning 4, I couldn't sleep. So next morning he asked me, how was it? Was it a comfortable stay? He has been living there for 30 years in that flat. I said, I don't know how you have been living. Even one night I could not sleep properly. Then he says, whenever he leaves that flat and goes to Delhi or any other place where there is no noises there, he cannot sleep. Because he says, I am habituated to this, and I find that it is like a cradle, like a child is put in a cradle and then some lullaby is sung. The railway have given him a free service of playing lullaby for him and his family, and he is very happy about it. So that itself says that one man's meat is another's poison, and the same principle should be applicable insofar as music is concerned.
Now, how do you select? If somebody goes to you for kind of relief from whatever, so how do you decide what kind of music therapy is good for him?
Well, in this case, suppose my friend in Bombay, he wants to have a therapeutic music, and I will have to find out what is his likes and preferences. Suppose he likes only that type of music, like a horizontal music, because he has developed certain intimacy with the railway track sound. So suppose in that railway track rhythms, more rhythm based and more percussion based music, straightforward music like tak 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 tak, like that. If I plan a music, and in that I will see which should be the beta level music. Suppose he wants a beta level music, I give beta level in that manner. And similarly, rhythm based alpha level music I will give that music, that is a slow tempo music, like a slow moving train. If I give that, he will be immediately receptive for that, and he will like that music. Not only he will like the music, he will be actively responding to those sounds. Whereas the same music, if I give to another person who is not used to the rail track music, he may find it a noise and he will not accept it. Similarly, if a person who loves Carnatic music, suppose I give a tune based on Carnatic music, then he will be receptive to that. Suppose I give him a tune based on jazz music, he would not be able to digest music, and he would not like to sort of even listen to that, leave alone reacting to that or enjoying it. So basically the concept is, whichever music is enjoyable to a person, that should be the genre of music which has to be selected for music therapy.
And what are the kinds of ailments that are treatable by music therapy?
So basically anything that goes with the mind, that sort of inadequacies can be overcome by infusion of music. So if there is any mental inadequacy, if there are situations like what we have in present day, the expectations are so much and people get frustrated so fast because all their expectations are not fulfilled. So this frustration gives rise to lots of tension, family tensions, sometimes tension in office, and tension even with friends. So all these things can be brought down to a considerable level if there is a habituation of music at least twice or thrice a day, at least for 10-15 minutes, and you take only those music genre which is preferred by a person. Suppose I like Bollywood music, let me be given a dose of Bollywood music with alpha or beta aspects.
That is basically the frequency. Alpha, beta, that is the frequency.
The rhythm alpha is basically, when I say alpha, it is not an activating music. It is a relaxing, soothing music. Whereas sometimes we need activation also. Suppose when we get up in the morning and we listen to Bhopal Raga, it is a wonderful raga because it activates you. Because your dullness which has acquired through your sleep, you rise to a nice morning ragas are there in Hindustani music. They are wonderful because when you rise with the morning ragas, then you get to the beta level because your brain gets readied so that you can face the challenges of the day.
You have just talked about tension, stress and all these things. Now many corporate offices today allow their employees to go in for yoga classes, because that is also seen as one of the ways of getting over these kind of problems. So how do you say that whether one should go in for yoga or music therapy, which is better?
I won't say anything is better. Rather, I would put that way that you combine yoga with music so that you get best of both the world. In the sense that if you see the effect of yoga, is also recently scientists have come to understand that when you do pranayam and things like that, what happens is that the feel-good chemical in your brain called endorphin, it gets secreted. Even in old people they have found this. So basically music also helps to increase our feel-good levels in our brains. So when you combine pranayam with music, an appropriate music is selected, then you will have a quicker benefit so that you get into a better mood change or better level of change in your consciousness level. So suppose you are aiming at relaxation, then you get quicker to a relaxation level, and your brain chemical also helps you in getting into feel good level.
Now there are some reports that music therapy has been used with some beneficial effect on Alzheimer's patients and people with defective speech. How do you think they really work in getting over these kind of problems? Alzheimer's is basically an old age problem. Old people forget a lot of things. How can music really reverse that or improve their mental ability?
I find that in music, if you listen to listen to any genre of music, you find lot of repetition takes place. If you take a Pallavi, Anupallavi, Charanam in Carnatic music, then the musicians repeat in an ektara. It's a monotone, so only single tone, tang 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 tang, like that. Only monotonic single tone is there that repeats. The idea is that over a time when you listen to that, it gets ingrained in you. Similarly, if you have a simple bhajan, repeat it 100 times, it gets ingrained in you. The idea is that through repetitive iterations, your brain get a training. So it's like a gym, in which you go and build your muscles and you stretch your hands and then fold your hands and things like that. Like that, in your brain, the tissues get stretched and the tissues get relaxed with the help of repeated tones. So this is how the mind gets trained, the brain gets trained, and to some extent by this training, your memory problem would be greatly solved. In the sense that suppose anyone has got a failing memory, by certain repetitions of a name, suppose you tend to forget a name, all you have to do is that 100 times you repeat the name of a person so that when he comes before you, remember his name. The same method. And the only thing is that instead of those names, we are using a tone. That is different.
No, this can work for Alzheimer's as you just explained. But how can it work with people with defective speech? How can it improve their speech ability?
This is also related to one observation about mathematics and music. There is a Fibonacci series. So in the Fibonacci series, it's like 1, 3, 5, 8 and like that. It goes in a series. That is a pattern actually. That is a pattern found in nature also. in sunflower seeds and in snails' body.
Yes.
All that thing, the same series works, and they have found that the same series works in respect of music also. The way you select a note in an octave is based on Fibonacci series. The speech is also a sort of a pattern. When we speak, we follow a certain pattern. Then only we are able to speak. It's not that speech comes like a water when you open a tap. It comes in a pattern base. Through music, you develop a pattern in your mind. And then from your mind thinking, you are speaking out. So the same pattern helps you to gain the pattern of speech. So your speech gets improved. That's what one Alfred Tomatis is a French author, and he has done a lot of research on Mozart music.
About 100,000 patients he has.
About more than 1,000 patients he has interviewed, and then he has found that there was one very famous actor, French actor, Depardieu, Gerard Depardieu, very famous actor. But when he was struggling to be an actor, he was not at all known to people. That time he had this speech defect. So he approached Alfred Tomatis on knowing from people that he gives music therapy. He was asked to listen to Mozart music for a number of days. And with that, this man could overcome that deficiency. And not only he could overcome, he became a superstar of French cinema.
Now, music therapy is said to have worked on autistic children also. Autistic children have very high intelligence, but they are not able to really communicate. How does music therapy work here?
In autism, it's a pattern deficiency because the children are not able to have a controlled pattern. And what they need is to have a pattern superimposed in their mind so that they will be able to behave within that pattern. Some of the autistic children don't like music. So they have to be slowly brought to the patterns of music because, they initially they do not respond well. But once they are brought into the pattern, then it's very beneficial to them.
Now, what other kind of disorders does music therapy work on? I find some reports about reducing acidity, reducing all kinds of other disorders, which normally has nothing to do with
physiological disorders. Because we have this psychosomatic concept that whatever happens in mind, for instance, if my mind is not well, my body also become ill. Then I develop certain acidity because, if I am very much frustrated and depressed and things like that, it causes acidity. So like that, to approach and treat the acidity, you treat your mind so that when the mind starts behaving well, then the body also starts behaving well.
Now, you have been working in this field for the last 15 years almost.
Yes.
Now, any of these studies, some examples you have just cited that they have worked, but has there been a control experiment to see exactly if there is a one-to-one relationship between use of certain ragas and the certain kind of disorder?
To sort of give avenues for this raga, because we have wonderful system of raga, which is unique in the world, but we have not made use of it fully. We are using it only for entertainment. And we are not using it for therapeutic purposes. We are sitting on a gold mine of ragas and raga system, and we have not done any scientific research. Although stray cases have been there here and there. In Bombay, some students have done. My own student in Chennai also has done recently on cancer and all that. But they are all very stray cases. But a massive approach we have to take, and the universities and other higher institutions should come forward to sort of test all these ragas. There are so many ragas, and with impact on mentally retarded children, impact on other people who are suffering from mental diseases. This will pave way for bringing out a new body of language, a new body of knowledge, which is not only useful for our country but for the whole humanity. So I think we must do like this. And very quickly we have to do that. Time is short.
Thank you, Dr. Sairam, for enlightening us about the new alternative therapy system, which can, as you say, which can work wonders in certain cases. And we hope that your work and you will go much ahead, and which will be definitely in the interest of humanity, as you just said.